So hello everyone. Our today's topic is about the our today's topic is about indirect retainers. Now what is the definition of the indirect retainer? An indirect retainer, it is a component of removable partial denture that helps the direct retainer in preventing the displacement of the distal extension denture base. And how does it uh, and how it occurs? It does it by using lever action that will resist the rotational forces around the fulcrum line that is established by the posterior most occlusal rest. So here is a diagram, the basic function of an indirect retainer. Notice how the denture rotates around this fulcrum line. The indirect retainer is placed perpendicular to midpoint of the fulcrum line that helps to resist the rotational movement. So can anyone tell me what happens to the denture if there is no indirect retainer? So what would happen if there is no indirect retainer? So without an indirect retainer, the denture, remember the denture, it is more susceptible to rotational movements around the fulcrum line. So this can lead to instability and displacement of the denture, affecting its comfort and the function. Now let us discuss the movements. The first movement is the movement of the distal extension base. The first is movement toward the tissue. So let us discuss the different types of movement that can affect removable partial denture and how we can counteract them. First, there is movement toward the tissues. So this figure represents the movement toward the tissue that is resisted by the reft and the reft seats. So reft are the component of the clasp that are located on the occlusal surface of teeth, and they act as vertical stops. So reft, they act as a vertical stops to counteract these downward forces. So what role do reft play in the managing forces that pushes the denture downward? So these rest would act as a vertical stop, preventing the denture from being pushed downward toward the tissue. So that helps to distribute the occlusal forces more evenly and maintaining the denture stability. So vertical stops, they will maintain the stability of denture. Next movement is a movement that is away from tissues. So here this figure represents so this type of movement that is away from the tissue affect the retention of the denture, and it is prevented by the activation of the direct retainer that normally remains passive. So the direct retainer helps the denture snug against the tissue Now, how does the direct retainer contribute to the retention of the denture? Let us discuss that. The direct retainer, it holds the denture in place by engaging with the denture with the teeth, ensuring the denture remains securely positioned and preventing it from moving away from the tissue. Now, movement can be in buccolingual direction. The buccolingual direction is horizontal. So this type of movement can affect the stability of the denture, and it is countered by the stabilizing component of denture such as the major connector and denture flanges, which helps to maintain the horizontal stability. So what component of denture helps to resist horizontal or buccolingual movements? Its component like the major connector and denture flange, it contributes to horizontal stability of the denture that prevent it from being shifting in the buccolingual direction. Now let us talk about the fulcrum line. So what is fulcrum line? Fulcrum line is an imaginary line that around which a partial denture tends to rotate. So this is an imaginary line around which the partial denture it tends to rotate. So this line is typically formed at terminal abutment axis. So formed at the terminal abutment axis, that is line joining the two posterior most occlusal rest. So the types of fulcrum line, the fulcrum lines can be retentive fulcrum line. So the retentive fulcrum line, it connects the retentive point of the clasp arm. It represents the axis around which the denture rotates when subjected to forces like pull of the sticky foot. So one is a retentive fulcrum line, other is stabilizing fulcrum line. The stabilizing fulcrum line connects the occlusal rest. It is the axis around which the denture rotates under the masticatory forces. Can anyone explain why it's important to understand the location of the fulcrum line? Understanding the location of the fulcrum line, it helps to manage the forces that are acting on the denture. By knowing where the fulcrum line is, we can design the denture to minimize the unwanted rotational movement and finally enhance the stability of the denture. Now let us discuss the principle of indirect retention and how these functions. Let us discuss that one by one. So imagine a long bar with single spot. So if you pull up on one end, the other end goes down. But if you add another spot on other end, the bar remains level. So this principle is similar to how the indirect retainers will work. The indirect retainer, they provide additional support away from the fulcrum line. So this additional support will counteract the rotational forces around the fulcrum line, and hence it will stabilize the denture. So what happens if the denture has only a direct retainer and no indirect retainer? So without an indirect retainer, the denture is more likely to rotate around the fulcrum line. So the direct retainer alone may not be sufficient to provide the rotation, so that could lead to instability and discomfort. So that is why there is need of the indirect retainer. So with direct retainer at the fulcrum, the lifting forces will depress one end of beam and elevate the other. And with the direct retainer and indirect forces will not lift the beam. Now, what are the factors that affect the effectiveness of indirect retainer? Now, what are the factors that affects the effectiveness of the indirect retainer? Several factors influence the effectiveness of indirect retainer. The effectiveness of indirect retainer. So, if the direct retainer is not functioning properly, the indirect retainer will not be ineffective. So the distance from the fulcrum line, the farther the indirect retainer is from the fulcrum line, the more effective it is. So the farthest it is from fulcrum line, more effective it would be. So that is why it should be placed as far as anteriorly as possible. Now, location of the fulcrum line. Ideally, the indirect retainer should be placed perpendicular to midpoint. Ideally, it should be placed perpendicular to midpoint of the fulcrum line. So, it should be placed perpendicular to this fulcrum line. The rigidity. The connector supporting the indirect retainer must be rigid. The flexible connector can reduce its effectiveness. The indirect retainer should be placed on a strong, well-defined rest seat. Avoid using a weak or inclined teeth. So why is the distance of indirect retainer from the fulcrum line important? The distance of the indirect retainer from the fulcrum line is important because a greater distance means more effective control over the rotational forces. So the farther away the indirect retainer is from the fulcrum line, the better it can stabilize the denture. So what might indicate an indirect retainer needs adjustment or replacement? So if an indirect retainer becomes dislodged from the rest seat, these suggest that the denture base may need relining or the indirect retainer itself needs adjustment. Now let us discuss the type of the indirect retainers. The first is the auxiliary occlusal rest. So this is the most frequently used type of indirect retainer. It is placed on the occlusal surface. It is placed on the occlusal surface as far as away from the distal extension base as possible. Avoid placing it on incisors due to the single rotation nature and interference with the tongue. The ideal rotation is central incisor, which is weak, therefore bilateral rest on the first premolar, they are effective. So why the auxiliary occlusal rest often placed on the first premolar rather than the incisors? Auxiliary occlusion rest are placed on the first premolar because these teeth have broader, more stable surface as compared to the incisors. We know incisors, they are single rooted and they do not provide adequate support for the rest. Plus they may interfere with the tongue. So remember in the Kennedy class 1 occlusion, there are bilateral reft are placed on the mesial fossa of the first premolar, and in Kennedy 2 classification, the auxiliary occlusal reft is placed on the mesial fossa of the first premolar on the opposite side. The next type is canine extension from the occlusal rest. In certain cases, the extension known as tug seat is placed from the premolars rest on the lingual slope of the adjacent canines. So this design is particularly used when the first premolar also serves as primary abutment. The term primary abutment refers to the tooth used for the direct support of the fixed or removable dental prosthesis. Avoid tipping action. Using this design helps to avoid the tipping action that can occur with a single cingulum canine rest. So why might a canine extension be used in conjugation with the premolar rest? A canine extension is used to provide additional support and stability when the first premolar it acts as a primary abutment. So it will help to avoid the tipping action that can occur if only a single cingulum rest is present. Other is canine rest. So when the mesial marginal ridge of the first premolar is close to the fulcrum line, so when the mesial marginal ridge is close to the of the first premolar is close to the fulcrum line, a canine rest can be given. So this rest can be modified by placing the minor connector anteriorly to the canine that hooks back into the cingulum. So this modification increases the effectiveness of indirect retainer by increasing the distance from the fulcrum line. So what is the advantage of placing the minor connector anterior to the canine rest? Placing a minor connector anterior to the canine rest increases the distance from the fulcrum line, and that is why it enhances the effectiveness of the indirect retainer. Other we can use is continuous bar retainers and lingual plates. Continuous bar retainers and lingual plates rest on the unprepared lingual inclines of the anterior teeth. While they are not considered indirect retainers themselves, they do help to provide the indirect retention. So they are converted to indirect retainer when they have a terminal axis. A continuous bar retainer or superior border of lingual plate should never be placed above the middle third of teeth to avoid the tooth movement in the Kennedy class 1 or class 2 occlusion. So what role do continuous bar retainers and lingual plates play in providing indirect retention? The continuous bar retainers and lingual plates helps with the indirect retention by providing additional support, especially when it include a terminal rest. So whenever there is a terminal rest. Now let us discuss the modification areas. In cases involving the modification area, certain teeth can act as indirect retainer depending upon the distance from the fulcrum line. In cases of class 2 modification 1 cases, if the fulcrum line run from the left second premolar to the right second molar. The supportive element of the direct retainer on the right first premolar can act as indirect retainer, as it is the sufficiently distance from the fulcrum line. An occlusal rest on secondary abutment can act as indirect retainer if it is not enough, if it's far enough from the fulcrum line. In the mandibular class 2 modification 1 cases, if T363746 they are missing a rest on tooth 1-3 can be used as indirect retainer to support the major connector. In class 2 modification 1 cases, how can you determine which occlusion rest will act on indirect retainer? The occlusal rest that is the farthest from the fulcrum line will be more effective as indirect retainer, as it provides the support while being positioned away from the fulcrum line to increase its effectiveness. Other is the Ruge support. The Ruge in the palate can also be used for indirect retention, especially when using a palatal horseshoe major connector. So the Ruge area, remember this Ruge area, it's firm and placed, making it suitable for providing indirect retention. And it is especially important when the palatal horseshoe shape lack adequate posterior retention. So what is the significance of using Ruge support in the denture design? The Ruge support is significant because it provides additional stability and retention for the palatal horseshoe major connector, especially in cases where posterior retention is inadequate. So the firm, well-placed Ruge will help to stabilize the denture. Other is the direct indirect retention. The reciprocal arm of the direct retainer located anterior to fulcrum line may also act as indirect retainer. The indirect retention can also be covered from the major connectors. In mandible retention from the denture base itself helps in indirect retention. In maxillary arch, full palatal coverage is necessary for the indirect retention when the anterior teeth are present. Incisal rest on that can be placed on the mandibular canines when mesial fossa of first premolar is close to the fulcrum line. So it produces tipping forces. Embrasure hook, it is less desirable, which engages anterior interproximal areas, and it is used when less positive seat to stabilize the indirect retainer.